Hello, everybody. Welcome to Millennium Live. Today, we're joined by Aaron Patzer. He's the co founder and CEO of Vital, which is a modern, intelligent digital health application that is transforming the care experience in hospitals and in emergency departments. Aaron is known for his success with Mint.com. I'm sure the audience here is familiar with, and it is for his ability to use technology to make complex things simple. So, without further ado, here he is. Aaron, welcome to the podcast.
Thanks for having me.
Of course. And let's just jump right into it. So, for anyone that's not familiar with yourself or Vital, could you just give us a brief introduction to the company itself and maybe your background as well?
Vital is a tool to improve your patient experience during a hospital stay. So our flagship product is called ER Advisor, and it walks people through what to expect during their emergency room visit. So how long they're going to wait to see a triage nurse, how long they're going to be in the waiting room, how long each of their labs is going to take. So we use artificial intelligence for wait times, which is the thing that most patients are very interested in. So that helps improve your customer experience, your patient satisfaction. We've increased HCAP scores by about 250% at some of our flagship hospitals. It also improves hospital revenue, make sure that people follow their follow-up instructions. So we use natural language processing, parse through those big 10 or 15 page discharge documents that most people just sort of throw away in the trash, and pull out like a to-do list. These are the medications that you need. This is the follow-up that you need. And that helps prevent readmissions. And then lastly, because it's a self-service application that between 50 and 70% of all patients in your emergency room use, like basically everybody who's conscious, it takes a lot of burden off of your staff. Registration staff and nursing in particular have far fewer questions to answer because the app answers like questions like, what am I waiting on? What's going to happen next? What should I do to speed up my visit? Where are the bathrooms? Anything like that is sort of taken care of in a self-service manner. And it's all super easy to use, which is why we have 50 to 70% utilization versus sort of an industry average of 10 to 20% usage of apps. We just make
That's
it
great.
super easy.
Yeah, that's awesome. That's a great number. And
Yeah. A little bit on my background, the reason why I think people use the software and it's been so widely adopted, it's been used by over 500,000 patients so far. We're now in 100 hospitals, up from 5 at the end of 2020, so growing very, very rapidly, is my background is in consumer software. So my co-founder, Dr. Justin Schrager, he's an emergency room physician. That's why this is tailored to ED patients and clinicians. I'll talk about the clinical side in a minute. But my background is I was a founder of Mint.com. It became the largest personal finance tool in the US and Canada. And then when that was bought by Intuit, I was a head of product innovation across all of Intuit. So if you've used TurboTax or QuickBooks or Mint or Quicken, those have had my fingerprints on them. And when you're making products for tens of millions of people, they have to be so easy to use, to navigate. The words have to be correct. The onboarding and sign up process has to be so easy that there's no instruction manual needed. Nobody has to look anything up. There's no training. I consider it just to be a travesty of the industry that doctors and nurses and all the staff go through days and days of training on big brand EHR software, or frankly any software. Why don't you make it so easy to use that it's like any good Apple app or social media app or whatever? You just know how to use it. You've never looked up an instruction manual for using Instagram or Google or anything. You just know how to use it. That's what we strive towards.
Well, that's great. And just on a side note, I just started using Mint this
Hmm.
year. It's very helpful tool. Been wish I would use it sooner. But can you dive in a little bit more to the this product that you mentioned about the ER advisor, and
Yeah.
talk about that solution a little bit, and maybe what it provides to the patient?
Yeah, well, I'll go a little bit more technical. So it sits on top of any EHR, so Cerner, Epic, Allscripts, Meditech, um, anything, and it's reading new visits coming through. So your EHR remains the system of record. We see a new visit pop up in your system because somebody's walked into the emergency room and registered the same way they would normally. And then we invite that person using a text message, and they get a unique link per patient. So it's kind of like a password reset link. It's secure per patient, and they confirm their last name. And that's all that's required. It's a web app. It's actually not from the App Store or the Play Store. You don't have to download anything. Loads super fast because the Wi-Fi or cell signal, which is often in the basement of hospitals, tends to be not the best. So you want that to load very quickly. These are the kinds of like subtle behind the scenes, like this is why it's more successful. And then we're looking at the timing of everything. So we're looking at, when did the patient register? Well, when did a triage note get opened in the EHR? When did it get completed? When was a new bed assigned? When was a physician assigned? At what time was the CT scan ordered? And at what time did it actually happen? How long did it take for the radiologist to interpret it? So we're looking at the timestamps of everything. And then we're correlating that with like the patient's age, their ESI, their severity, in order to make predictions. Because if you just use past timestamps, you're always going to have a lagging indicator of how long somebody's going to be in. If the last people were waiting 5 hours to see a doctor, you actually don't know that they're waiting 5 hours until 5 hours in. And then for the people who are just arrived, your predictions are now 10 hours late. So you actually need to use artificial intelligence to look forward in time. And the only way to do that is to know number of beds, how many people are arriving per hour, how many people are leaving per hour, how backed up is it when people are admitted. And so there's really sophisticated algorithms. We've actually published 5 peer-reviewed papers on our technology, not just for wait times, but we can predict likelihood of admission. We can predict ESI as well as nurses can, it turns out. We're working on sepsis prediction using not just the typical things people use, which is vital signs, but we're looking at free-form text in doctor and nurses' notes. So that's something that I don't know of any other health company doing, which is being able to use free-form text. So we use a very sophisticated natural language processing using word and paragraph vectorization techniques that were sort of only invented by Google a couple of years ago. Whereas most of the people who are doing, quote, AI in health tech are still using algorithms that I would consider to be from 30 or 40 years ago. So we're definitely on the bleeding edge of this stuff. And it's sounds good, and it is good, and it works really well, but ultimately you see very little of it. You just see that the wait times are super accurate. People are really happy. You see as a clinician, this person is likely to be admitted, or this person's likely to be septic, and it'll tell you why we think that. But the technology just sort of works. And the whole goal of technology to me is to make life easier for the patient, for the patient care experience person, for the doctor, the nurse, the social worker. We sort of have different technology, different algorithms for each of them.
Of course. I mean, that's innovation at its core. And I know at the core focus of Vital is to provide a consumer grade experience for anybody who maybe uses this. How is Vital unique in its mission, especially in the healthcare space? Because this it gets tricky because you're providing value to patients, and that's always you always have to take a little bit of a step further to that. So seeing that the vital solutions are really easy to use, I'm sure this didn't happen overnight. So maybe talk about the mission a little bit and expanding on your team's work to ensure that Vital does provide the best user experience it can.
Yeah. So in some sense, our mission is simple. It's to create a beautiful and intelligent software assistant for patients and clinicians. It's as simple as that. Literally, the word beautiful is in our mission statement because we care about design and we care about usability. I don't know any other health company that like where beauty is literally in their mission statement. So it may be, of course, to help patients, and that's number one for us, but it's got to be beautiful and it's got to be intelligent. By intelligent, I mean it doesn't ever replace anything that clinicians do. It's an assistant, and it's something that lets you work at the top of your license if you're a clinician. There is so much work that we make doctors and nurses do that is, for lack of a better term, it's kind of beneath them. The amount of, whether it's paperwork or busy work. And the more that you can automate, the more information that you can push to patients and their families so that they're well informed and they have efficient conversations with clinicians, the better. The more that you can make sure that every single alert is relevant and actionable, because the types of alerts that you get in the emergency department are very different than in the ICU, that are different on the cancer ward, that are different in the maternity unit. And so you
Right.
have to recognize that and allow that kind of personalization, which is something we do on the clinical side. Likewise, the way that we approach software, I think, is very different. I always like to put myself in the shoes of the patient and just say, what is the big thing that I want to know? So if it's in the emergency room, it's how long am I going to wait before I see a doctor? How am I going to wait before this problem is, quote, fixed or the pain is resolved? So what are the ways that you can help people achieve that? For an inpatient stay, it's sort of like, am I getting healthier or not? Was today a good day? Did I heal? Man, I've been sitting in this hospital bed for a week. I am so both bored and in pain, and am I making progress or not? And so we have been working on this algorithmic health meter, literally like a dial that's like red, green, yellow. Are you getting healthier day by day? Looking at your vital signs, looking at subjective things like your muscle strength and mental alertness and things that nurses measure. Looking at whether your lab values are improving or declining. Looking at your mobility and your ability to be self-sufficient, your ins and outs, how much you're eating, all of these things, how many lines you have in, how many IV medications you're on, what's the intensity of care, how many notes were written about you yesterday versus today. Very complicated thing, but all to serve this very easy goal from the patient's perspective. Am I getting better? Am I getting closer to getting out of here? Very difficult, actually, to know whether that's true and to be accurate most of the time, and not people false hope. But that's the way we think about it. And so we're willing to attempt tools and ideas that I think no one has ever done before, in part because there are a lot of healthcare software is beholden to the economics, and Vital certainly makes you about $1 million per ED that you are installed in. But what I mean is you're ticking compliance boxes. You're like, we're supposed to educate people on their medication side effects. And so we'll show videos on that and try to get them to do the things that we need to do as a hospital for our accreditation or to reduce liability, which is fine. You do need to do those things, but those are table stakes. That's thinking in terms of what we need as a hospital. That's not thinking in terms of, I'm a patient and this is one of the worst experiences of my life. What do I want to know? What does my family need to know? Because there's a big sharing aspect to Vital as well. We've had 130,000 people, or families rather, receive shared visits so they can follow along with what's happening in the emergency department. You've seen a doctor, not seen a doctor. We have that same sharing capability in our new inpatient product. And what's brilliant about that is every morning I might be 3,000 miles away. Is grandma a green thumbs up or, just sort of stable, or like a red thumbs down? If I see 2 or 3 of those, red thumbs downs in a row, maybe I fly across the country and see her. If it's green thumbs up for 5 days in a row, I'm like, great, peace of mind. I can go about my day. I'm not worrying about a sick relative. But it's an amazing sort of feature. And I don't know why people don't think in the context of not just patients, but their families as well.
Yeah. Well, yeah. I mean, that's a big point because when someone's in the hospital, it's not doesn't only affect the person who's there. affects the families, friends, and whatnot. So that's a lot of information too. And I think you answered one of my questions that was coming up about the benefits of using Vital in the hospital. But beyond the user experience of the ER advisor, what makes Vital different compared to some of the the other vendors who are vying for the time of these hospitals and health systems who are looking for technology like this?
Yeah. We are a startup and we are a product and engineering oriented startup. So if you look at like literal the makeup of the company, it's very different than most companies. Most software companies in health are very, very sales heavy. And of course, we have a few salespeople, but we are, we're about 50 people now, and 30, 35 of them are product design, engineering, building. And so we build very, very quickly, particularly by health standards. So ER Advisor has been out for a year and a half now. It's now at 100 hospitals as of today. I just did the count, and we're at 100 hospitals.
That's great.
Our inpatient product, we developed that late last year. We just sort of did a pilot, and now it's going to be generally available sort of at the end of June, July timeframe in this year. Our clinical AI, are alerting on sepsis and probability of admission and a bunch of other hospital-acquired infections. That's coming out this year. So we're putting out products at a very rapid pace for a small team because we care so much about technology and design.
Let's reverse gears a little bit. Let's talk a little, challenges, because there's always challenges when you were dealing with the healthcare system, right? So what
Yeah.
are the biggest challenges that you saw for?
Yeah. I mean, the big challenges that we solve for are Vital will improve your patient experience scores. So those would be HCAHPS or EDCAPS scores. And literally, I can think of like 6 different factors. There's likelihood to recommend, but it's also, was I informed about weights? Were my friends and family kept informed? We literally have features for keeping your friends and family informed. How was my wait time? We may not change wait times, but we certainly change the perception of it. So we can pre-program an apology, that comes 90 minutes into your wait. We're sorry you're waiting so long. Is there anything that we can get you? We're moving as fast as we can. Just some, human element that says, doctors and nurses are too busy to talk to everyone all the time and answer all their questions. But you have to treat people like people. Just acknowledge the fact that it's 7 p.m. on a Tuesday and it's really busy in the emergency department. And we're sorry about that. And we're, don't go anywhere. We're going to get to you as fast as we can. And we see people in the order of, severity. And if you need anything, we'll get it for you, and you're safe now that you're in the building. So that peace of mind is really important. We also solve for revenue for hospitals, which is to say, we did a study at Emory, which is one of our first places. I think 11% of people were following up after the emergency department
11%.
visit.
Wow.
11% were following up. Should be about 50%.
Yeah.
After you've been in an emergency. This was with Emory affiliated clinics, so they may have been going to places where we didn't have insight, to their family care doctor or to a competitor or something like that. We increased that to 15%. That was an additional 12,000 visits, mostly to specialists that Emory wouldn't have gotten that year. That was worth about $7 million in immediate revenue, not long-term downstream revenue of people getting, expensive orthopedic surgeries or anything, but just people going to the specialists and the follow-up care that they needed. Well, that keeps them healthier. That, reduces readmissions. That brings revenue from those specialist appointments into the healthcare system. And then there's downstream effects that are probably 5 or 10-fold in terms of the economics. So there's a big economic impact. I think primarily, though, people buy it for improving the patient experience. Now, lastly, it is what I said, which is saving doctor and nurse time. If I had a very simplistic way of looking at Vital, what we do is we're tapped into your EHR. We're looking at all this stuff, all the notes and labs and results and everything that's going on behind the scenes. And we are interpreting that to communicate with patients and their families the same way that a doctor or a nurse would if that doctor and nurse had infinite time to spend with each and every family. what's going to happen next. Here's why you're getting this lab. Here's what this result means. It's kind of like automating as much of that humanistic communication as possible is a really big advantage of Vital.
Yeah. And to help not only the patients but clinicians as well. I mean, that's a huge step in in terms of managing a big health system. And you mentioned that Vital is in 100 over 100 hospitals now and across 28
That's
health
right.
systems.
That's
So
right.
so perhaps can you share any outcomes from your partnerships or anything like that?
Yeah, I've mentioned a few of them. So HCAP scores improved by about 250% across like 6 different dimensions at Dignity St. Joseph's Hospital in Phoenix, Arizona. That was one of our first sites within Common Spirit. I think we're now in 25 or 30 Common Spirit affiliated hospitals. With Emory, we had 12,000 extra follow-up visits to Emory affiliated specialists and clinics over the course of a year. That was across 4 emergency departments. That was about $7 million or about $1.8 million per emergency department in incremental new revenue after having installed Vital. And then, just another result that I'm just pleased with is we have between 50 and 70% of all patients using the software. Our highest utilization, I think, is at UPMC Children's Hospital. Parents really care about their kids and everything that's going on with them. And so I've seen utilization in some weeks as high as 75%, which is just insane. Like literally everybody is glued to Vital, looking at their updates on wait times, watching the time tick down, watching the orders and results come in. 4 out of 5 things are resulted. When's that last one going to be? So the doctor comes and talks to you, and then you can get out of here. It's just a really happy result to know that at a children's hospital, 75% of parents are choosing to use this.
And that's really great. That's great news. So CEO, head of product. Uh,
Hmm.
you have a good background in bringing technology to help make people's lives easier. What I'm curious, what's your philosophy about innovation, just as a whole? Just a big summary.
Well, it's
Loaded question, but
yeah, Vital really fits in with my own sort of life mission or purpose, which is it's sort of a funny thing because I don't know. When I was younger, I always wanted to be Thomas Edison. I have 10 patents to my name, which is cool. But
wow.
what I discovered that I'm really good at and what my life's mission really is to take industries that are complex and full of kind of anxiety and fear and bring a kind of simplicity, calm, and understanding to them, because I guess it's kind of the way that I value my own thinking. There's a lot of chaos in life. There's always so many options. And if you can just whittle it down, make it simple, make it easy, make it calm and understandable, which is something that I think that I did with Mint in finance. Finances are complex, and the average American has 10 different financial accounts and relationships when you include student loans and mortgages and credit cards and all of that. And we put it all together in one place. And then with Vital, healthcare is even more complex than that. And it's scary. And like, God, I'm 41 and I've worked in this industry for 5 years now. I'm not 100% sure that I understand insurance in the US. I just,
I don't think anybody does.
I, but how does anybody have any chance to like understand their health, the financial aspects of it, what medications and what those should cost and how to get them and what you can substitute in terms of generics versus brand. Like, it's just endlessly complicated. And so guiding patients and their family members, and to do it while you're sick or while you're old, like there is so much help needed in this industry to bring just a great experience and to bring patients and their families and caregivers together to not just do what I think hospitals are good at, which is prevent death and alleviate pain, but it's really only patients and families and the guidance that you can give them, hopefully through software, that can achieve health, which is different than simply the alleviation of pain.
Sure.
Hospitals sort of pick people up once they've fallen off the cliff, as they say. Our ultimate goal is to be that assistant to keep you healthy after having gone through something like this.
I mean, that's awesome, and it's so exciting to hear about all the great innovations that's happening at Vital and continue to do so. I mean, Aaron, it's awesome to talk to you. You have so much insight on this. I do have a final question for you though.
Sure.
What's on the horizon? You're doing so much right now, and it's just incredible to see this type of technology out there, and health systems and just people overall just using it and being excited to do so. So what are you most excited about? What do you see in the future?
One of the things that I'm most excited about is this concept of like a care experience platform, which is to say your healthcare experience is not just in the hospital, and those are our primary, customers, if you will, the buyers of our software, but it's the care coordination with your PCP, with specialists, with the ACO that you might be affiliated with making sure that they have all the information that they need to coordinate care with patients and with family members. So it's getting the whole, I guess, team involved. And what that would ultimately mean is very easy, accessible, and of course, secure information that crosses the boundaries of health systems and EHRs. It's kind of funny that there's no real, we call it national HIE or tool that all the doctors and all the hospitals and all the care coordinators are using. So ultimately, to be that platform would be, the goal. It might take decades to get there, but the system is still so fragmented. This is not dissimilar to what I faced at Mint, where there are, or at least were in 2006 when I started it, 12,000 different financial institutions, banks and brokerages and mortgage lenders, 12,000. We connected up to 12,000 different information sources. All of them had varying degrees of quality and issues, and it had to be normalized and brought together to give you just an easy picture of your finances. Healthcare is not dissimilar. It's like hundreds of hospitals or tens of thousands of clinics, all providing slightly different data that needs to be normalized. We use SNOMED for our coding system internally because it's the most comprehensive. To present a cohesive picture of your health, it is a massive data cleansing, data integration problem. In order for you then to put the algorithms and AI that we do on top of it, and the algorithms and AI are really just to serve to make things easy for patients, but it's like you have to add all of these layers and layers and layers in order to get to that ultimate simplicity for patients. It's not easy. Simple is the hardest thing in the world to do.
Yeah, I know. Well, I mean, this is fascinating stuff. I could listen to you for much longer than this. So excited to hear all about what Vital's doing. We should catch up later in the year to maybe revisit some of these topics. All the wonderful things that Vital is doing to help improve the care experience overall for both patients and clinicians, and making healthcare better for everyone, and to keep things beautiful and intelligent, because I think that's a wonderful way to go. So Aaron, thank you for your time today, and we appreciate you being on the podcast.
Thank you, Connor.